Hi friends. We just thought that there's this very interesting times that we are in. We are leading through times, these COVID times, wherein we don't know what happened yesterday, whether it holds true tomorrow. And like a few days ago, we coined a word that BC and AD will no longer exist. It will be BC would stand for before Corona, and instead of AD, which was Anno Domini, we would probably say NW, which is now what? Because every day is a new day, and we are dealing with a new pandemic which is going to create new problems as every day passes, and we have to provide new solutions. So I guess there will be a lot of challenges. It's a very interesting time for cardiologists because we have a lot of places by which there is an intersection with which we are having with the coronavirus infection. Although by and large coronavirus infection causes respiratory illness and causes maybe a viral pneumonia, but we have to realize that a lot of presentations, especially those who are sick, and those presentations are largely more in the vulnerable population, which has all got cardiovascular morbidities. For example, our learning from people in China, Italy, US, UK has been that the elderly, the hypertensives, the diabetics, those who are immunocompromised, and those who suffer from coronary artery disease are going to be more vulnerable to this infection. That means they are our patients. These are patients that we interact with on a day-to-day basis. Secondly, the symptoms that they present with, symptoms of shortness of breath, symptoms of cough, symptoms may very well be cardiac symptoms. And we know that chest pain, shortness of breath are common manifestations of cardiac disease. And since the population vulnerable group is just the same, these may well be presenting with something which we may mistake as having just acute pulmonary edema, whereas they may actually be having COVID pneumonia and respiratory failure. So we have to be very careful in these times. And furthermore, we know that this is a very transmissible disease, which means that the R naught, as the whole world has become a world of epidemiologists, and everybody, just like cricket taught us all, that we are all expert commentators. So similarly, we've all been taught by coronavirus infection. I mean, the whole world's become a world of epidemiologists. So everybody knows figures like herd immunity, R naught, transmissibility. We all know the mortality, the case fatality rate, and all these terminologies have become largely everyday use in every household. So with these terminologies, we also understand that we need to protect ourselves. We also understand that we need to protect our patients. As physicians, we cannot be held responsible for transmitting this infection, which can have issues by coming to us from an asymptomatic carrier. We can't carry them home to elderly parents or to young children. And at the same time, we need to exercise judicious care that we don't deny patients their rightful treatment. People who come with heart attacks need to be treated promptly, and we cannot have the whole world wishing that or not reporting when they had chest pain. So these are clearly difficult times, and obviously we have a lot of issues with which we have to combat and deal with on a day-to-day basis. So we held this Facebook Live thinking that in case there are any such issues that we need to discuss, we would really welcome those questions, and we would try to provide those answers. See, the coronavirus may have come to us through dubious means. The chrysanthemum bats were what were probably responsible for transmitting them to humans. But once the explosive illness happened in Wuhan, in the Hubei province of China, and later moved on to Europe, UK, and the US, it's today become a global pandemic. There was a time that everybody was obsessed with daily rising figures, but today people have even stopped looking at those figures because those figures have become rising so exponentially that we do not know where to fit them on a curve, except that they're exploding in our faces. We don't even know whether these figures are true, not because of any conspiracy here, but because figures are directly dependent on the number of people that we are testing. But we know clearly that this is a killer disease, and and we know that this killer disease is something which can kill people. It can kill people by infecting them, and they can have not only respiratory compromise, hypoxemia, they can have thrombotic illnesses, and they can have manifestations which can kill them over a period of hours. Initially, the medical fraternity possibly overreacted because we kept thinking, oh, here's going to be a cytokine storm, this is just another ARDS, and we need to give them a lot of oxygen, and we need to give them a lot of positive end expiratory pressure. But we learned a few things. Now, by the time that we moved on, we learned that that may not be always good to take patients onto a ventilator. You need to maintain adequate oxygen levels, but need to be judicious about it. And moreover, we need to also understand that maybe just a high flow nasal oxygen, which at one time was thought to be increasing the viral load, may be the way to go. We all know that nursing patients in a prone position helps us. But how we are going to use this in our day-to-day scenario is something which we have to learn to do. We also know clearly the value of social distancing. We know clearly the value of having making sure that we wear masks, and not just around our necks, but actually to make sure that we don't have droplets which we can create, which are the easiest means for this virus to transmit from one person to another. If there are 100 people who've got this virus, and we don't know these 100 people, we know that 80% of them are going to have only mild or moderate disease. 50% may not even realize that they have an infection. And only about 20% of them are going to have recognizable disease, and only 5% of them are going to have sinister forms of disease requiring critical care, and the mortality is about 1%. So if we look at this, this is not such a great thing. You can think of it as a good thing, but not such a great thing. And the reason is because the SARS epidemic, which happened about 10 years ago, had a mortality of about 10%. But what it meant was that a lot of people who contracted this illness were recognized easily and died, not infecting a huge population. Whereas here, the transmissibility is very high, but at the same time, the mortality is not very high. Though surely, in that 1% in whom it is going to have bad outcomes, it is going to be very, very fatal. So we have to understand this disease. At the same time, we need to understand how we are going to prevent it. Very simple techniques: social distancing, maintaining a mask, hand hygiene, washing hands, washing face with just soap and water is possibly good enough. But there come issues. How do we travel in an elevator? Well, we can travel in an elevator with multiple people. And one of my closest friends called me an hour ago and asked me a question that people in his building don't know whether to get in people to come in and repair the air conditioning. How do we handle the air conditioning? Well, we all heard that air conditioning should be handled with maintaining temperatures between 24 and 30. But if you want to get a guy to come in and clean your filter, should you do it or should you not do it? And should you do it, should you make him wear a hazmat suit, or should you make him wear a PPE class 3 or not? So these are questions which are practical. And we all realize that, yes, your mask is your friend, and the mask has to be worn appropriately. You should not mess with your mask. Avoid touching your face and avoid touching various parts of your nose, etc. Avoid doing this. And this is very important, that once you've worn a mask, that you're not doing anything else with it. You're not fingering it, because that is the easiest thing for us to do. So if you have an air conditioning repair guy who comes in, before he comes in, make sure he does his hand hygiene. He cleans his hands, make sure liberally use sanitizer, make sure the sanitizer is used on all aspects of his hand before he comes in. He wears his mask. You wear your mask. And everybody around you wears their mask. In the elevator, he takes precautions that he does not speak too loudly, transmitting infection, does not lower his mask to be seen, identified, or being heard when he comes in. And once he comes in, he quietly goes, does his thing. Or after he has done his thing, well, at the time he comes in, he wears gloves. Because you make sure that touch is another thing which can change things. We also know that the virus can possibly stay for a couple of hours on fomites. And although this transmission is a little sub judice, because the CDC and the WHO took away some of the features or some of the potential infectious profiles. But we need to be careful. Whatever the world may say, we need to be careful, because it's our family, it is our people, it's ourselves that need to be staying away from infection. We have patients, we have people at home. So take all precautions. So make sure the guy wears a pair of gloves. The gloves can be anything. Make sure that once he comes in, he does whatever he has to, wearing a mask, you're wearing a mask. Once he finishes, he again disposes of these gloves appropriately, does hand hygiene again, and disposes of this mask in an appropriate fashion. So here is where we started, but I'm sure there are a lot of questions that are going to come to various people. So we've researched this in the last couple of weeks. We collected a whole lot of data on how this virus transmits. We understand that in hospitals we've created yellow, red and green corridors for people who are either infected or suspected to have infection, or who are not infected. We also took precautions, because many of our procedures that we perform in the non-invasive lab could be potentially aerosol generating. When we are performing an echo, we tend to get very close to a patient, and if you have a mask, the patient is wearing a mask, well, there could be times that we have taken precautions. But again, frequent hand hygiene is important. You don't always have to don and doff expensive PPE gear, but definitely in the catheter lab, and certainly when the COVID status is not known of a patient, you should take these precautions. And we follow a buddy system, because when we are donning and doffing this PPE gear, we have to be careful that we don't make mistakes. So the buddy tells you that where you have accidentally touched, you touch with a little alcohol and stay free. At the same time, we also must understand, I mentioned that people who have not been tested, but these tests themselves are of dubious value, because by and large what we do in these tests is we take a nasopharyngeal swab and we do a real-time PCR, reverse transcriptase, a polymerase chain reaction, to assess who has got this disease. And I must confess that at best this is going to be positive in only about 65%, which means that even if the swab has been appropriately taken, which means that even if the swab has been appropriately transported, for those who have got disease, only about 2/3 of them will be reported as positive. And the maximum positivity comes in the first 5 to 7 days, a maximum around the 5th to 7th day. And before or after that, we really don't know how much is the transmissibility potential. We know clearly that even in the first 5 days, even before the PCR becomes positive, you can still transmit. But what about the 11th or 12th day after a patient who has probably had a mild illness? We still don't know. The WHO and the CDC have tried to tell us that maybe after the 11th or 12th day, your infectivity potential goes down. But like I said earlier, it's your life, your family. So let's continue with the precautions. And there's no harm done being extra careful, but there could be harm done by being less careful. So I would really open this to questions. We very clearly know we have no treatment disease. A lot of people advocated a whole lot of drugs, hydroxychloroquine, although our experience with chloroquine and hydroxychloroquine has been for many decades, and we don't think it's as unsafe as some parts of the Western world have made it out to be. But we need to still be careful, because there is no drug without side effects. And yes, chloroquine, especially in combination with, say, somebody who's taking azithromycin, can have, and maybe also an antihistaminic like cetirizine, can increase the QT interval, can increase the possibility of your getting polymorphic ventricular tachycardia after increasing the QT interval. But everybody is not going to have a QT interval checked. And these terms like QT interval, polymorphic VT were alien to all of us, not cardiologists, but the rest of the population, till such time the COVID epidemic or pandemic happened. But now that we know about it, we need to be careful. So really the data regarding hydroxychloroquine has not been based on very robust trials. The first French data was for 26 patients. Not enough for the whole population to be exposed to this. Somebody's asked a question that how can we boost the immune system? Well, boosting the immune system, I don't know any magic. I don't know any particular drugs which will boost your immune system. I know a whole lot of drugs which will deplete your immune system. But what you can do is eating healthy, exercising healthy, staying in good mood, and being positive about life. And those are things which are actually going to boost your immune system more than, say, a particular homeopathic drug. I mean, even my wife came and gave me some sweet pills and said, "Oh, take this. It's going to boost your immune system." But I'm not sure whether taking nutritional supplements really boosts your immune system. Yes, taking some micronutrients, there is no harm. If somebody adds on, say, a wheat grass or something else, I don't see any harm. But I don't also see potential for a panacea. There's another question: is it safe to take normal fever and other medicines during COVID-19 without consulting doctor? See, 86% of patients who had a COVID-19 infection did have fever. But we are also recognizing some people who did not have fever yet had severe COVID-19 disease. Unfortunately, just 2 days ago, we lost one of our doyens, one of our master teachers, Professor J.N. Pandey, with mild COVID-19 disease, succumbed to this illness while he was asleep. But it is also known that he had comorbidities. So these are people who need to be even more careful. And normal fever, we kind of, I do not know what is normal fever, because fever means that you have some illness. And yes, taking a lot of NSAIDs, which are non-steroidal anti-inflammatory drugs like Comiflam, Brufen, Naproxen, are not desirable. So for the question that has been asked, even for normal fever, please do not take so many drugs to make sure that your fever comes down. If at all you have to take something, take paracetamol if you are feeling unwell, and that is reasonably safe to take paracetamol. Now, when you do contract this disease, and like I said, 50% are not going to have any symptoms whatsoever. So there is a lot of, what shall I say, phobia about people. Oh, we are not going to get an ECG done because going to a hospital means you're going to be exposed to COVID. Well, this is not really a good thing, because despite the fact that initially the world thought that we are going to have lesser and lesser people with heart attacks, it is not true. People still are having heart attacks and still are need to have their EKGs done. 1 hour ago, I told one of my very close friends that he needs to go to a hospital to get an EKG because he had some chest pain. So we can't run away from realities of life. Hospitals are not some place where you go to contract COVID, but you need to have appropriate testing done from time to time, for which you need hospitals. People say, oh, I can come to a private doctor's clinic, but I can't go to a hospital. May not be entirely correct and may not be the way to go. These are kind of myths that have been built in. So we have learned a few things about heart attacks and COVID. In the initial phase, we thought that, oh, where have all the heart attacks gone? We are not seeing people with heart attacks we are not seeing them in our clinics. We are not seeing them in the ERs. We are not seeing them in the hospitals. And this was a global phenomena. And we really figured out that it was not really people having less heart attacks, but the fear of contagion was keeping them away. And people kind of preferred to die at home with the heart attacks rather than come to the hospital. Some cardiologists felt, oh, maybe we can treat these patients who have heart attacks. And you must understand one thing, that we also realized that sometimes we did angiograms and found that the coronaries were normal in these patients. What does that mean to us? It means that there can be a form of a heart muscle involvement. Because again, for this, I have to take you back to some basic science. The coronavirus itself has spike proteins, and these spike proteins attach to receptors, and these receptors which are used are the same as the ACE2, which is actually the ACE receptor which we use to target a lot of drugs which we use to treat high blood pressure. So initially here, because especially after our Wuhan experience, there was a fear that patients who are on these ACE inhibitors. And what are ACE inhibitors? Ramipril, also called Cardase, enalapril, also called Envas, or and ARBs, which are angiotensin receptor blockers, like telmisartan, olmesartan. These are losartan. These are common drugs that we use, and these drugs could be increasing the potential of the patient to acquiring coronavirus infection. But really, we have not found this to be true. So, for heaven's sake, don't let your blood pressure spiral upwards just because you have stopped your ACE inhibitors or ARBs. And I can see Tamkin's asked a question, but I think I will see initiating a small dose. He has said something which I will have to make it of antiplatelet like aspirin. Yes, Tamkin, I agree with you. The thrombotic component of this coronavirus infection. So once this coronavirus comes into the system, it kind of activates a whole lot of triggered enzyme cascade systems. And one of the systems that it kind of triggers, apart from causing a viral pneumonia, which blocks your oxygen transport in the lungs, is to go and attack these the ACE receptor, which is ubiquitous. It is present on the myocardial cells, which is the heart muscle cells. It is also present on the vascular cells. And once it causes involvement of the vascular cells, it can possibly promote a thrombotic component. And that is why my good friend Tamkin has asked whether aspirin would be enough. Well, we don't know what is going to be enough, because we are going to realize all this much later. What it is going to tell us is that we also need to treat these patients as potential thrombotic illnesses. And we have found that a few patients had IVC thrombus, which was in the inferior vena cava. A few patients had thrombus in the pulmonary artery, and so on and so forth. Also, we found that potential to cause thrombosis in the coronaries increased. So we maybe need to put them on forms of heparin. Now, what about patients who present with what is medically called ST elevation myocardial infarction? But when we shoot their coronary angiograms, we find that their coronaries are clean. So initially there was this view that, we want to keep everybody safe. Let's not do primary angioplasties. Let us just give these people clot busting drugs, which are called fibrinolytic drugs. So should we do that? But really, what we are seeing now that we are in the third month probably of this pandemic, what we are seeing is actually that some of these patients have normal coronaries. So is it fair for us to actually give them fibrinolytic agents, which may actually cause more heart muscle ruptures and so on and so forth? So we have actually taken a back seat. We promoted a pharmacoinvasive strategy because the European experience was that a lot of these patients were those who presented late because of fear of contagion, which is appropriate. But we thought that, okay, if you think that there is a heart attack and you can't test them because you know that the testing takes 6 to 8 hours, and in a heart attack you need to act fast, you need to act quickly, and you need to act decisively. So we would do the test at admission, but we know that we can't wait for the results. So the Chinese colleagues taught us that we could actually take them quickly through a CT scan and look whether they had any involvement of a viral pneumonia in their lungs. And if we did not, take them to the cath lab and do what is called an angiogram, followed by a primary angioplasty. And since many of you are familiar with what is an angiogram and angioplasty, I'm not really going to go into details of it, because this will make sure that we are not unnecessarily giving them a lot of clot busting drugs which could have deleterious impact, and treating what is appropriate and treating the way we were treating normally, even pre-COVID or in the before COVID era. So we have learned that lesson. So not only in India, but if you look at what happened in Europe, especially Italy, Spain, UK, and in the US, we know that a lot of people went through treatments of recommendations of fibrinolysis, but all the societies over a period of time put this in the back burner and came back by saying do more testing, do a CT if required, but use full PPE gear, which means that wear a hazmat suit, wear protection to your nose, take all protection to your hand hygiene, take them to the cath lab, check out their coronaries if they have features of ST elevation on ECG, and perform a primary angioplasty, taking full care. Remember that the care is not just in the cath lab. The care also has to be in the intensive care unit after this patient goes away from there. And we know that it is going to take 6 to 8 hours for the result to come. And even if the result comes negative, I told you that only 2/3 of patients are going to have a positive result. So you may need to test again a second time. And that is why it is very important. I see that Kirti has joined us now, but I had answered Kirti's question a little while earlier. Kirti arguably is India's foremost cardiologist and my friend. And he had asked this question about the AC guy coming in. And like I said, we don't have to make sure that everybody is on a hazmat suit. Now there is a question which is regarding what happens because the government has opened air travel. Now should you do air travel? Well, don't do it unless it is mandatory. Because whatever the precautions that the government may institute, no precaution is 100% foolproof. And so therefore, we would have been happier if the middle seat had been kept vacant. But I guess that is a decision which people other than medical authorities or medical professionals have to give to the government. And for everybody else to understand that your life is in your hands. So you need to take all precautions to keep yourself, your family members, your friends, and people that you're dealing with safe. And it is your responsibility. So the Prime Minister had used this term Atmanirbhar. And I don't think that there is any other place for us to be more self-dependent than during travel or during exposure to this virus. I would not hesitate in saying that one should take complete precautions and wear gloves, wear a mask, wear as much of precautions as you do. Do not talk loudly. Do not go to the loo in an air flight. Make sure that you are protected. Also, do not touch people onto your sides. Make sure that you're carrying adequate sanitizer. Touch anything, any place that you may have accidentally touched. And so you need to protect yourself. And I think this is where all of us have to exercise caution. And I know it's not easy. And I know that sometimes it becomes a little tricky. What if you have touched? What do? Well, clean that place immediately with your sanitizer. There is no drug that you can take. There is no vaccine at this point in time. Maybe a year and a half later, we would have something like that available. But right now, the only thing that you can take is personal protection. So I would really request you all to ask questions, because that's the only way we can cross-link ourselves with we may learn something very exciting from one of the questions that you've asked, and I will try and answer them with whatever little that we've been able to glean from a variety of reading, in various fora and discussion in various fora. So I would really welcome any questions. So here is a question which somebody's asked, is that I had a cold and I declined to get tested because I was not happy about being taken away if I was found positive. And this person says further that, if I was taken away, if I was found positive, my neighbors who are helping me right now would stop helping me. Well, sir, you may think like that, but we have responsibility to the community as well. And we can't only always think about our comfort, because it all comes back to us. हमें अपने लिए नहीं, सबके लिए सोचना है, और उसको सोचने के लिए हमें वो सब चीज़ें करनी है कि सोचें कि ये इन्फेक्शन अगर मैं प्रिकॉशन लेता हूँ तो शायद मैं ही प्रोटेक्ट नहीं हो रहा हूँ, बट मेरे रिश्तेदार भी प्रोटेक्ट हो रहे हैं. सो ये सब चीज़ें हमें समझनी है, इसका हमें अमल करना है। एक और क्वेश्चन आया कि हम इम्यूनिटी कैसे बढ़ाएं। सो मेरा एक पुराना फॉर्मूला है, मैं उसी को रिपीट करता हूँ। हार्ट डिजीज़ के लिए भी वही फॉर्मूला है, मैं उसको कोविड के लिए भी अप्लाई करता हूँ। सही आहार, सही व्यवहार, सही विचार, समय अनुसार उचित उपचार, तो शायद नहीं पड़ेंगे हम बीमार। अगर हम इसको फॉर्मूला को लें, सो ईट न्यूट्रिशियस डाइट. It doesn't mean that if you're locked in, it doesn't mean that you splurge on high calorie diet only, but at the same time you should not deprive yourself. My mother is very annoyed with me because I was trying to do intermittent fasting and lose some weight during this time, but I guess I needed to lose weight. But जहाँ पर सही आहार की बात है, look at micronutrients. Your diet should be a balanced diet. Don't overindulge, but at the same time don't deprive yourself of micronutrients. The second thing is sahi vyavhar. Now initially we had issues about going out. There were government stipulations about going out for a walk, and there were some very interesting WhatsApp jokes which said that you can't go out after 7 p.m. because the coronavirus attacks you at 1 minute past 7 p.m. Well, that jokes apart, even when it was prohibited to go out and go for a walk, you can find a staircase to walk in. You can walk in your own balcony. You can walk in creating a corridor for yourself which you can use to walk in your house, but keep physically active. Do things ऐसा करें कि आप अपने, चाहे योग करें, योग अभ्यास करें, चाहे आप पुशअप्स करें, पुलअप्स करें, चाहे आप स्पॉट रनिंग करें, आप कुछ भी करके आप अपना रेगुलर एक्सरसाइज कर सकते हैं। तो ये है व्यवहार। दूसरी चीज़ व्यवहार में मैं बताना चाहूँगा कि बहुत एक डिसअपॉइंटिंग सी चीज़ थी, कुछ लोग इससे नाराज़ होंगे मेरे कहने से, बट आप ये सोचें कि जब पहला लॉकडाउन खुला और दुकानों को अख्तियार था कि वो कुछ बेच सकें, सबसे ज़्यादा भीड़ थी कहाँ पर? अल्कोहल वेंड्स पे। 70% एक्स्ट्रा टैक्स लगने पे भी अल्कोहल वेंड्स पे मारामारी थी। तो आई वुड से दैट डेफिनेटली some people have commented this morning in a DD News show that I was being asked questions on, that a smoker of 30 years during coronavirus gave up smoking, and I think it's a very good thing. Smokers are at very high risk of contracting this disease. They are also immunosuppressed, and I think we should encourage all people given to tobacco to give up tobacco at this time. Tobacco can be even chewable tobacco. We know it increases risks of various diseases, and also definitely cigarette smoking, bidi smoking, hookah smoking should be given up at this time. So सही, हमने कहा सही आहार, फ्रूट लें, छाछ लें, अब गर्मी आ गई है, गर्म पानी का सेवन करें, गरारे करें, ये इम्पोर्टेंट चीज़ें हैं, क्योंकि इससे हम we can make sure that we are and maintain good oral hygiene, which can make sure that we contract less and less infection. Increase your hand hygiene. लोग कहते हैं वो उसको OCD है, वो बार बार हाथ धोता रहता है। Well, इस टाइम पे शायद OCD होना आपके लिए फ़ायदेमंद है, नुकसानमंद नहीं है अगर आप सिर्फ हाथ ही धो रहे हैं। अगर बाकी किसी चीज़ में OCD हो गया तो शायद गड़बड़ है। दूसरा हमने कहा कि सही व्यवहार, एक्सरसाइज करें, आप अपने सही विचार भी बहुत इम्पॉर्टेंट है। अभी मेरे एक फ्रेंड आए, मुझे थोड़ी देर पहले दिखा के गए, उनको बहुत डिप्रेसिंग ख्याल आए इस दौरान में, और उससे उन्होंने खाना खाना छोड़ दिया, उनका वज़न कम होने लग गया। अगर उनका वज़न तो कभी ज़्यादा था ही नहीं, ही वॉज लाइक आइडियल बॉडी वेट, और वज़न कम होना अच्छी चीज़ नहीं है। तो मैंने उनको यही सलाह दी कि आप अपने आप को प्रोटेक्ट करें, और सही आहार, सही व्यवहार, सही विचार, समय अनुसार उचित उपचार में हम देखें कि जिन लोगों को कार्डियोवैस्कुलर रिस्क फैक्टर्स है, और तमकीन ने फिर एक सवाल किया है कि स्टार्टिंग स्टैटिन्स, देखिए मैं ये नहीं जानता कि क्लोरोक्विन और स्टैटिन्स में कौन सा अच्छा है कौन सा बुरा है, पर ये ज़रूर है कि अगर आपको स्टैटिन्स वैसे इंडिकेटेड हैं प्राइमरी या सेकेंडरी प्रिवेंशन के लिए, तो आप अपने आप को डिनाई मत करें। ये बहुत ज़रूरी है कि जिन को जो एंटी हाइपरटेंसिव्स, एंटी डायबिटिक्स, एंटी लिपिड एजेंट्स हम प्रिस्क्राइब कर रहे हैं, वो ये प्रिस्क्रिप्शंस कंटिन्यू करें इस पीरियड में। मुकेश ने सवाल किया है कि गर्म पानी पिया जाए कि नहीं। देखिए, मैं कहूँगा एक तो नंबर अव्वल पहले पानी पिएं, और अगर किसी ने थोड़ी देर पहले पूछा था कि मेरा गला ख़राब है, मैं क्या गर्म पानी से गरारे कर सकता हूँ, ज़रूर करिए, वो आपके लिए फ़ायदेमंद है। गर्म पानी से या मंद पानी से, हल्के टेम्परेचर के पानी से आपको फ़ायदा होगा। हाँ, प्यास लगेगी तो डिहाइड्रेट मत होइए, क्योंकि अगले 9 दिन आर सपोज टू बी द हॉटेस्ट डेज ऑफ द ईयर। सो इसमें स्पेशली पेशेंट्स ऑफ हार्ट डिजीज़, जिनमें हम वॉल्यूम का बैलेंस रखते हैं, उसमें हम ये करें कि उस बैलेंस में ये ना हो कि हम डिहाइड्रेट ही हो जाएं। सारस्वत श्रुति ने पूछा है कि विटामिन सी यूज़फुल है। देखिए, विटामिन सी लाइनस पॉलिंग के ज़माने से बहुत लोग सोचते आए हैं कि विटामिन सी लेंगे तो आपकी इम्यूनिटी बढ़ेगी। इसको सोचने में कोई हर्ज नहीं है। विटामिन बी, विटामिन सी एक्चुअली वाटर सॉल्युबल विटामिन्स हैं, तो एक्सेस ऑफ विटामिन सी और बी आपको हो नहीं सकता। तो आप विटामिन्स एडिक्वेट लीजिए, आप विटामिन्स एडिक्वेट लेने में कोई नुकसान नहीं है। ए, डी, ई एंड के जैसे 4 फैट सॉल्युबल विटामिन्स होते हैं जो एक्स्ट्रा भी जमा हो जाते हैं। तो स्पेशली आजकल क्योंकि विटामिन डी की बहुत ज़्यादा प्रिस्क्रिप्शंस होती हैं, तो कुछ मरीज़ों को हम आगाह करते हैं कि विटामिन डी सोच समझ के लें या टेस्ट करके लें, इसलिए बहुत ज़्यादा मत लें। लोगों ने तो ये भी कहा है कि विटामिन डी लेने से आपकी कोरोना वायरस के प्रति इम्यूनिटी बढ़ती है। किसी ने जिंक को फ़ायदा बताया है, किसी ने मैग्नीशियम का फ़ायदा बताया है। मैं इसका सही उत्तर नहीं जानता, ना ही कोई साइंस वाला व्यक्ति बोलेगा कि वो जानता है, बट इसको हम आजमा के देख सकते हैं। थोड़ी क्वांटिटी में कोई नुकसान नहीं है, पर बहुत ज़्यादा अगर हम क्वांटिटी बढ़ाएंगे तो स्पेशली विटामिन ए, डी एंड के फैट सॉल्युबल विटामिन्स हैं, तो शायद हम ये नुकसानदेह भी हो सकता है। और एक सवाल आया कि एजिथ्रोमाइसिन हर एक पेशेंट को क्या दिया जाए। तो जी नहीं, ऐसी कोई बात नहीं है कि एजिथ्रोमाइसिन हर एक को दिया जाए। जी हाँ, जब ये पैंडेमिक शुरू हुआ था, मेरे कोलीग को ज़ुकाम हुआ था, तो हमने उसको उस टाइम गला ख़राब था, एंटीबायोटिक देना था, फीवर था, देखा कि कुछ उनके काउंट्स बढ़े हुए हैं, तो कुछ बैक्टीरियल कंपोनेंट था, तो वहाँ पर हमें सोचा कि एजिथ्रोमाइसिन भी दिया जाए तो अच्छा होगा। पर इस ज़मान हमें अगर एक और सवाल है कि करेक्ट डोज क्या है विटामिन्स का। देखिए, मैंने बताया वाटर सॉल्युबल विटामिन्स का कोई नुकसान नहीं है, पर ए, डी, ई एंड के फैट सॉल्युबल होते हैं, उनको एक्सेस में मत लीजिए। बहुत लोग पूछ रहे हैं कि भाई ये कोरोना वायरस कब ख़त्म होगा, कब ख़त्म होगा कोरोना वायरस। उसके लिए हम नहीं जानते कि कब ख़त्म होगा। पॉसिबली जब हर्ड इम्यूनिटी हो जाए, और हर्ड इम्यूनिटी का कॉन्सेप्ट ही बड़ा अजीबोगरीब है। एक यूके के प्रधानमंत्री ने सोचा कि भाई वो कोई बात नहीं, वो हर्ड इम्यूनिटी के लिए वो भाई अपने आप को एक्सपोज करेगा। ही ऑलमोस्ट डाइड इन द प्रोसेस। तो हम यही सोचते हैं कि हम हर्ड इम्यूनिटी के प्रति ना जाएं, हर्ड इम्यूनिटी स्वाभाविक रूप से आ जाए तो अच्छी चीज़ है। एक सोनिया जी ने क्वेश्चन पूछा है कि इन्फेक्शियस पीरियड क्या है। आफ्टर यू हैव कॉन्ट्रैक्टेड दिस इन्फेक्शन, इफ यू हैव कॉन्ट्रैक्टेड इट, even before you test positive, you can be infectious. You are likely to test positive around the 5th day to the 8th day of acquiring this infection. और अगर आपको इन्फेक्शन हो गया, माइल्ड मॉडरेट डिजीज़ है, उसके 10 दिन तक आप ये वायरस एक्सक्रीट कर सकते हैं अपनी नेज़ल ड्रॉपिंग्स में, एरोसॉल्स में, तो आप तब तक इन्फेक्शियस हैं। तो लोगों ने कहा है कि WHO और CDC ने कहा है कि अगर आपको फ्रीक्वेंटली टेस्ट करने की आवश्यकता नहीं है कि आप नेगेटिव हो गए। अगर आपको बुखार हुआ और बुखार आपका ठीक हो गया और उसके 10 दिन उपरांत हम सोच सकते हैं कि आप अब इन्फेक्शियस नहीं है। अगर आप पॉजिटिव हो तो भी आपका वायरस इन्फेक्ट नहीं करता। अब इसकी पूरी जानकारी किसी के पास है नहीं, और कोई ऐसी बीमारी नहीं है कि हम चांस लेने की कोशिश करें। हाँ, हम ये याद करें कि ये बीमारी उतनी भी घातक नहीं है जिस तरह की इबोला या नीपा वायरस की बीमारियां थीं। परंतु इसमें एक फ़ायदा भी है और एक नुकसान भी है, क्योंकि ये घातक नहीं है इसका ये मतलब नहीं कि हम इससे, कोलोकियल वर्ड्स में यूज़ करूँगा, पंगा लें। बिकॉज हमारे लिए घातक ना हो, पर हमारे घर में जो लोग बैठे हैं या जिन लोगों से हम संपर्क में आए उनकी अगर इम्यूनिटी डाउन है, उनके लिए घातक हो सकता है। तो ये जानना ज़रूरी है कि हमें यूनिवर्सल प्रिकॉशंस लेने हैं। हम ये ना समझें कि हम कभी भी अपना गार्ड कम कर सकें। तो सोनिया जी का जो सवाल है कि इन्फेक्शियस पीरियड क्या है, फ्रॉम द टाइम ऑफ कॉन्ट्रैक्टिंग दिस इन्फेक्शन टिल 10 days आफ्टर you are relieved of this infection, it can be contagious. फोमाइट्स की, जैसे कि कार्डबोर्ड, पेपर, क्या अखबार से हो सकता है? किसी ने सवाल पूछा। अखबार से, अखबार वाले तो कहते हैं, लिख के रोज़ देते हैं, इकोनॉमिक टाइम्स में लिखा आता है कि नहीं होता। बट मेरे घर में मेरी वाइफ सुबह अखबार आता है तो उसको आयरन करती हैं। पता नहीं ये सही है कि गलत है, बट देर इज़ नो हार्म इन टेकिंग एक्स्ट्रा प्रिकॉशन, बट देर इज़ हार्म इन टेकिंग लेस प्रिकॉशन। आइवरमेक्टिन के लिए राघवेंद्र तिवारी जी ने प्रश्न किया है कि कोविड पेशेंट को दिया जा रहा है। देखिए, जब भी कोई ऐसी बीमारी आती है तो बहुत लोग पेनेशिया का तलाश करते हैं। बहुत लोग सोचते हैं मिल गया मिल गया मिल गया, हमें इसका जवाब मिल गया। और शायद अगर साइंटिफिकली कोई जवाब मिल भी जाएगा, सो वी विल बी वेरी ग्लैड टू हैव इट। बट एज ऑफ नाउ, एज ऑफ 26 May 2020, don't think we have the answer. We neither have a virus, we neither have a vaccine, nor do we have a treatment for this virus. Now, having said all this, I am not trying to dissuade all those brilliant people who are working hard in search of having a vaccine against this virus. But let me tell you, for any new therapy, कोई भी नए इलाज को अमल करने के लिए, we have to prove that it is efficacious. We also have to be prove that it is safe. और इसलिए इसका प्रूफ देने के लिए हमें समय लगेगा। मीडियन पीरियड ऑफ एक्सपेक्टेशन, FDA ने बहुत चीज़ें फास्ट ट्रैक की हैं। प्लाज्मा थेरेपी पहले भी यूज़ हुआ है, बट प्लाज्मा थेरेपी को इस प्रेजेंट पैंडेमिक में, क्योंकि हम लाचार हैं, हम विवशता के लिए से आगे बढ़ने के लिए, इन दिस हेल्पलेसनेस वी हैव ट्राइड टू यूज़ एवरीथिंग, सो दे हैव फास्ट ट्रैक्ड प्लाज्मा थेरेपी। बट अदर थिंग्स, सारंग ने सवाल किया, जिंक का क्या यूज़ होगा? नो हार्म डन इन एडिंग जिंक, बट do you think zinc alone will change the course of a severely infected coronavirus patient with a lot of viral load, or it will prevent a cytokine storm? I am not sure. I am glad Mukesh has said that even he irons the newspaper and there is no harm in taking precautions. And I welcome Admiral Duhan, who is now watching this, and I welcome Dr. Zehra from Aurangabad, who is watching this. These are friends, and it is good to be in connect with friends. Now, I must tell you a few words about Admiral Duhan, my friend. General Duhan, Admiral Duhan, in his various avatars, Dr. Duhan is a very famous gastroenterologist who is also a great mountain climber and a marathon runner. Despite the fact that he was and has been my patient, he has also been my friend, philosopher, guide, my mentor, but at various points in time in life. But he continues to be full of life, and he goes, and we wish him luck in his next mountaineering expedition, and I'm sure that he will have more marathon runs which he will have. So there are some more questions which are coming by as to when do you ventilate a patient. I think you should leave that to your doctors to decide. Yes, severely ill patients should be hospitalized. Mild, moderate infection, self-quarantine, home quarantine should be enough. We don't want to overburden the healthcare system. ये नहीं होना चाहिए कि माइल्ड इन्फेक्शन को ही हम देखते रह जाएं। तो मेरे को याद आता है कि जब हम छोटे थे तो एक वो ऐसे ही किसी ने पैरोडी बनाई थी एक नीरज के गाने की, और उसमें था कि इंजेक्शन क्विनीन के, स्ट्रेप्टोमाइसिन के हम इंजेक्शनों का इश्तिहार देखते रहे, मरीज़ मर गया, हम बुखार देखते रहे। It should not happen. we should not get, we should understand that we should recognize mild moderate disease, we should understand severe disease, recognize when a patient needs to come into a hospital. We should understand that monitoring this patient, protecting ourselves from infection, protecting cross infections is important. We should also understand when this patient will need intensive care, when this patient will need ventilatory therapy, and we should use that. So we should leave that from to our doctors to decide. The government has done a great job in trying to get. जब हम 3 महीने पहले ये शुरू हुआ था तो मेरे को याद है कि मैंने अस्पताल में बोला कि भाई N95 मास्क मंगा दो. लोग मेरे ऊपर हंसे कि इंडिया में भी N95 मास्क मिलेंगे या FFP3 मास्क मिलेंगे. आज N95 मास्क की भरमार है. जब हमने PPE पहले मांगे एक प्राइमरी एंजियोप्लास्टी करने के लिए तो लोग हमसे रिटन एक्सप्लेनेशन पूछा कि आप क्यों मांग रहे हैं. पर आज कोई PPE की कमी नहीं है. सरकार ने मेहनत की है, इंडस्ट्री ने मेहनत की है कि PPE गियर अवेलेबल है, पर इसका यूज़ जुडिशियस होना चाहिए. गवर्नमेंट ने कुछ गाइडलाइंस दी हैं, हम कहेंगे कि उन गाइडलाइंस को बरता जाए. शायद पर्सनली हम अगर 2 स्टेप ज़्यादा लें तो एंड ताकि ये PPE ऐसे गलने के लिए नहीं रखे हैं, ये PPE इस्तेमाल करने के लिए रखे हैं. ये आपके हमारे प्रोटेक्शन के लिए हैं और ये पर्सनल प्रोटेक्टिव इक्विपमेंट जो है ये हंसने के लिए नहीं है. इसमें आप चाहे N95 मास्क हो चाहे शील्ड हो, इनको यूज़ करें. हमें जाना पड़ेगा 65 साल की आयु के बाद. जैसे मेरे फादर की मेरे से हमेशा झगड़ा रहता है. मैंने उनको घर में बोला कि विनम्रता से कि एक लक्ष्मण रेखा है, आप बाहर नहीं जाएंगे, पर आदत से मजबूर हैं. घंटी बजती है, वो दौड़े जाते हैं कि भाई कोई गेट पे है, लेट मी एटलीस्ट डील विद हिम. दिस हैज़ टू बी अवॉइडेड. हाथ जोड़ के लड़के उनको समझाने का प्रयास किया, पर ये घर घर में प्रयास करना है कि जो उम्र में 65 वर्ष की आयु से ज़्यादा है, मोर देन 65, जो डायबिटिक हैं, जिनको हाई ब्लड प्रेशर है, जिनको कॉर्नरी आर्टरी डिजीज़ है. अब ये डायबिटीज़, हाई ब्लड प्रेशर, कॉर्नरी आर्टरी डिजीज़ एक तरह से एक हाई रिस्क सबसेट इंडिकेट करता है. जिनको किसी को जो कैंसर का इलाज चल रहा है, जिनको ऐसी दवाइयाँ दी हैं जो कि इम्यूनिटी को सप्रेस करती हैं, उन सब लोगों को. मेरे पास एक रेजिडेंट था, वो उसको स्प्लेनेक्टमी हुई थी और लोग उसको फोर्सिबली ड्यूटी पे डाल रहे थे. तो वो ऐसी चीज़ें हमें अवॉइड करनी हैं. बिकॉज क्यों हम एक्स्ट्रा रिस्क लें जो हम रिस्क अवॉइड कर सकते हैं. पर ये भी है कि हम मकरापंती ना करें. कई लोग इस पैंडेमिक में मकरापंती करने लग गए, अपनी जिम्मेवारी नहीं एक्सेप्ट करते. वी शुड ऑल एक्सेप्ट आवर रिस्पॉन्सिबिलिटी और प्रोटेक्शन के साथ अगर हम जनता की सेवा भी करेंगे तो आई एम श्योर भगवान जहाँ पर भी होगा, ईश्वर, अल्लाह जो भी है, हमारा साथ रहेगा. वी हैव टू बी केयरफुल. हमें दिमाग यूज़ करना है, हमें अपना विवेक नहीं खोना है. हमें ये देखना है कि हम पूरी प्रिकॉशन लें, पर इसका ये मतलब नहीं है कि हम लोगों को अपनी शफा से वंचित करें. हाँ, ये मतलब नहीं है. वी शुड डिप्राइव पीपल ऑफ द अप्रोप्रिएट ट्रीटमेंट. एंड फॉर दिस आई मस्ट से दैट आवर फ्रेटर्निटी, the medical fraternity of the entire world, do you know that the maximum number of mortalities that have happened in any fraternity have been the healthcare workers? They are yours. We need them to get respect. Unfortunately, that respect is lacking. Everybody thinks of a medical professional as a commodity to be used. Maybe they will be nice to you when you are treating them, and once that is over, they think that in inverted commas somebody is being paid for it. I think everybody has to change this mindset, because we can also sit at home. We can also sit at home and not do all what we are doing or what people in COVID wards are actually doing. Arvan has asked a very intelligent question. As always, he has asked, is it important to use air conditioner? And I will really give an example for this. Any temperature prevented? Well, the government has said that you should have temperatures between 24 and 30 degrees. In a personal car, I don't see any disadvantage in using an air conditioner. In using a window or a standalone or a VRV air conditioner, I don't see a problem. The problem comes in public places. The problem when you are sharing an unit. And in this problem, I must say that many hospitals, and we have been on many webinars with our colleagues from other countries like Singapore, Hong Kong, and even in our own country, there have been hospital units, and you know that even your government has not allowed you to use malls as yet, because malls use common air conditioning. And in hospitals, we must be careful about which all places have standalone air conditioning, which all places share a common air handling unit. And then we need to know कि वो एयर हैंडलिंग यूनिट में पॉजिटिव प्रेशर इम्पैक्ट है कि नेगेटिव प्रेशर है. आई कैन शेयर विद यू दैट इन क्वीन एलिजाबेथ हॉस्पिटल इन हांगकॉन्ग उन्होंने 2 लार्ज हीपा फिल्टर कैथ लैब में लगाए हैं विद अ चिमनी विद नेगेटिव फिल्ट्रेशन. सब ने अपने दरवाजे बंद किए हैं ताकि हम सिर्फ नेगेटिव प्रेशर रखें और सारी एयर फ्लो जो है वो बाहर की तरफ जाए और अंदर की तरफ वो एयर ना सर्कुलेट करे जो कि हमारे पेशेंट से आ सकती है. नाउ ऑल दिस हैज टू बी यूज्ड अप्रोप्रिएटली. एंड ये नहीं मैं कहता कि हर एक जगह आपको ऐसे लार्ज हिपा फिल्टर्स लगाने हैं, बट इन प्लेसेस वेयर इट इज़ इम्पॉर्टेंट लाइक क्रिटिकल केयर एरियाज, like in ICUs, like in cath labs, in OTs, we probably need to do this. मनीषा जी ने निकला है कि गवर्नमेंट अगर स्कूल खोल देगी तो क्या करना है. और मुझसे ये सवाल डीडी न्यूज़ पे कोई 5-6 दिन पहले किसी ने पूछा था कि बच्चे बाहर जाएंगे तो उनको कौन रोकेगा. तो मैंने उनको यही बताया था उस टाइम भी कि बच्चों को ट्रेन करना ज़्यादा आसान है बनिस्बत हम लोगों के जो कि आदत से मजबूर होते हैं. बच्चों को अगर समझाया जाए तो वो शायद समझ जाएंगे. अभी तो मुझे पूरा यकीन है कि हालांकि कई यूरोपियन नेशंस में स्कूल खोल दिए गए हैं, इंडिया में अभी स्कूल नहीं खोलेंगे, पर अगर खोलेंगे तो बच्चों को हमें सेंसिटाइज करना है. बिलीव मी, 1918 में स्पेनिश फ्लू का पैंडेमिक हुआ था. बहुत लोग हताश हुए थे. हम में से तो कोई उस टाइम जिंदा नहीं था, बट मैं एक किताब पढ़ रहा था, बैरी की किताब द ग्रेट इन्फ्लुएंजा एपिडेमिक. बहुत बढ़िया किताब है. एंड इट वाज रियली, इट टोल्ड अ स्टोरीज. और हिंदुस्तान की कई स्टोरीज आपने अगर सुनी हो महामारी की उस टाइम, इट वाज वेरी इन्फेक्शियस, वेरी फेटल. सो आई एम श्योर द गवर्नमेंट विल टेक प्रैग्मेटिक पॉलिसीज रिगार्डिंग स्कूल्स. बट ये जो हमारी जनरेशन है बच्चों की, ये समझदार बच्चे हैं. और अगर ये इनके टीचर्स और पेरेंट्स उनको गाइड करेंगे, आई एम श्योर इसका इम्पैक्ट होगा. सने ने एक सवाल पूछा है कि एयर ट्रैवल फेटल ना हो जाए. देखिए, फेटल तो मैं कह नहीं सकता. कोरोना वायरस जरूर फेटल है और संक्रमण आपको एयर ट्रैवल से के कांटेक्ट से अगर आप पर्सनल प्रोटेक्शन पूरा नहीं लेंगे आ सकता है. तो मैं आपसे यही कहूँगा कि आप एयर ट्रैवल मजबूर होगा. ओनली दोज हु आर compelled to travel utilize air travel. High risk people should not even dare to challenge. मैं हमेशा ये क्लिनिकल प्रैक्टिस में भी कहता हूँ और ये चीज़ें समझाए तो समझते हैं, पर गोस्वामी तुलसीदास रोट इन सुंदरकांड के सचिव वैद गुरु तीन जो प्रिय बोले भाई हास, राज धर्म तन तीन को होए बेगही नास. तो सचिव, योर मिनिस्टर्स, योर ब्यूरोक्रेट्स, वैद हम जैसे डॉक्टर्स, गुरु, द नॉट ओनली योर टीचर्स बट योर स्पिरिचुअल लीडर्स एंड द की ओपिनियन लीडर्स ऑफ द सोसाइटी, तीन जो प्रिय बोले. डोंट एक्सपेक्ट अस टू से एवरीथिंग इज राइट व्हाट यू आर डूइंग, बिकॉज इफ वी डू दैट तो राज धर्म तन तीन को होए बेगही. So don't forget that. So what we are trying to tell you is that we must take full travel only if mandatory. Use maximum protective gear. Be completely atmanirbhar and self-independent during your travel. Don't touch things unless you're required to. Don't use the loo. Don't get up. Use your sanitizer frequently. Look at this as if you're walking a tightrope and you're doing enough to make sure that you don't contract the infection. Like I said, the premise is that you already decided that your travel is so imperative that you need to challenge the coronavirus. So Sanit has again asked a question: are we doing enough with tracing, tracking and testing? You want me to challenge the government, sir? Well, even related to our per capita income, I think we could have done more. But I must still compliment the government and the authorities that they've been thinking on their feet. I believe personally lockdown ought to have come 3 weeks earlier. And I think that may have changed things. But truly what we need to do is that we need to educate people. This is a disease where we can only create a circuit breaker if we educate everybody. And if every person is not just an island, but is a source of inspiration, let every person that is educated become the sun itself. And the sun radiates so much of energy that he educates all around. And with this education, we ensure social distancing, we ensure that we ensure personal protection, we ensure frequent hand washing, we actually exercise complete precaution. No, Sanit, I'm not making it political. This is not about politics. This is about personal protection. I am 100% sure that the business of running this country is more than just a healthcare advice. Healthcare advice can be at one side. The business of running the country is a very complex business. Just like when we handle patients, it's a complex business. Running an economy, running a people, running the mindsets of people is a big challenge. And I really compliment the government for what they've done. And we will always feel that we could have done better. But that's in retrospect. In prospect, let you and I be the change that we want to happen. Let you and I implement all of this, that we need to change the way we thought. I cannot forget, you called me a few weeks ago and said this is really been a big problem for me because it may need me to change the way I'm going to think. People have to look at alternate vocations. People have to think as to how we are going to deal with this problem in the future. So my friend Satyashiva from Kuala Lumpur is asking, in retrospect, we did realize that the emotional intelligence of mankind has a long way to grow. Any advice from the youth? No, sir. No advice. The youth of India is smarter than us. They are going to see everything. They are going to use everything, and they are going to use it to their best advantage. I just want to tell them, no bravado. Don't try to be a hero and become a zero. If not for yourself, for your parents, for your children, for your brethren, for the people of this greater good of mankind. Let us respect each other. The problem is, we are arrogant people. We have this tu janta nahi main kaun hu attitude. We have this, I see even on the borders. Till a few days ago, there was one line. Today, there are multitude cars, no discipline, no lines. Why could we not have tried to use this opportunity to become more tolerant of each other, to become respectful and mindful that we need to give space. We need to cooperate with the government. We need to cooperate with the healthcare authorities. We don't have to steal a march over each other. Who are we stealing a march with? Getting infected? Succumbing to coronavirus? Do you know that the combined weight of all the coronavirus in the world, which has brought this supreme human race to its knees, is less than 2 grams? Yes, sir. The weight of coronavirus is in petagrams, and the combined weight is less than. So I think that this is important, and we need better civic sense. Sonia has said that we need better civic sense and consideration for our fellow citizens. Yes, ma'am, I fully agree. I have no choice. I have to agree. She's my wife. So I have to agree with what you're saying, and we have to. But if there is any medical question, my phone is running out of battery, and I think we have been on this for the last about 1 hour. So maybe we can do it again a few days from now, and we can meet again, and we can touch base with figures. Let me also tell you, look at news. Yes, Sanit, I agree. Resilience, tolerance, education, knowledge are the key and need of the hour. Very well said. I compliment my young friend Sanit Bahari, very intelligent man. He is a computer genius. He says resilience, tolerance, education, knowledge. Yes, there could be keywords. But to close, I must say that this is a medical problem, but we need social solutions more than medical solutions. We will keep working. Medical fraternity will keep working towards finding better and solutions to this problem. Well, Sonia, you are proud of your country, so am I. We have all stood at the borders, but and India needs to. Who said India is not great? India is great. Great, but we need to improve. There is always scope for improvement, and I think we should care for greater good, and I think we should look at greater good of mankind, because it's just not borders which are going to come between us, which I think we all need to. And Duan sir is saying stay healthy, stay safe. I would say stay safe, everybody. Let's meet again after a few days, and we should have the next session, and we should have more of you here. And stay safe, friends, and take care. God bless.